Hello, my name is Ayesha. So, my topic was on preventing readmission of the patients with heart failure. So, as we know, a little background, as we know that heart failure is progressive disease that is characterized by cell dysfunction of the heart muscle, so which causes heart to pump not enough blood to meet the body's demands. So while I was reading the book, I found that prevalence of heart failure is about 6.5 million aged 20 years or older in the United States, with million new cases each year that occur with heart failure. So that's a lot of people that are really young, are have certain lifestyles that lead them to have heart failure later in their life. So we know that there are many reasons that can cause heart failure. There are many reasons, but some that are common, such as hypertension, coronary artery disease, diabetes, smoking, metabolic syndrome. But I learned that my articles mentioned that obesity, high sodium diet, and sedentary lifestyle are the most common reasons that lead patients to be readmitted into the hospital because of those reasons for heart failure. And in one of the articles, I found that they discussed that people are readmitted due to also lack of compliance with their treatment, so by not taking their medication or missing their doses. I also read that people mostly get readmitted because they fail to modify their lifestyle and they stick to this unhealthy lifestyle, keep up with the unhealthy diet, and don't manage to lose weight, which is critical. So I had 3 different articles, and most of them stressed about the need to lose weight in order to prevent heart failure, and many also other diseases. But to be healthy, it is crucial to also include a healthy diet along with weight loss. If we modify the risk factors and treat the underlying cause of the disease, such as heart failure or disease that lead to heart failure, can improve and lower the risk of heart failure. So in some of the risk factors are obesity, sedentary lifestyle, and unhealthy diet, which leads to obesity. If patients be compliant to their medication, it can also lower the risk of heart failure. So most patients with heart failure are prescribed diuretics that help them decrease the fluid volume, ACE inhibitors that can help decrease the workload on the heart, and beta blockers that can help lower heart rate. Also, inotropic agents that help with the contractility of the heart muscle. So these medications work along with adding physical activity and eating healthy diet. In my article, they mentioned some tips that we can give to the patients to begin their journey developing a healthy lifestyle. So it's recommended for patients to perform at least 150 minutes per week of at least walking or bicycling or any other exercise that can get their heart rate up, and get them moving. Also, they could start the journey of eating healthy by starting to have portion control for their meal, so having portion size controlled, and adding a little more fruits and vegetables per meal. They could also select whole grains and choose low-fat protein sources such as turkey and white chicken breast. So simply planning their meals ahead of time will stop them to not stop at fast food restaurants when they're hungry and eat junk food that consists of a lot of sodium, which leads to heart failure pretty much, and many other diseases as well. So as we know that exercise will strain the heart and pump more blood, which delivered more oxygen to the body and in the end increase lifelong expectancy. But it should be noted that people should individualize their physical activity routine with what they can handle and add rest breaks to their activity. Lastly, the articles talked about the patients and family should know their signs and symptoms of heart failure, which can expedite the treatment and reduce hospitalization. So people should know what a heart failure would look like and what the signs and symptoms are. Thank you. Bye.